Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your questions on injury, rehab, training, or technique. We'll be taking your calls shortly. Call 767-8884 for your direct line to Sports Doctor. Here's your host for tonight's program, medical reporter Joe Chapana.
Good evening and welcome to another edition of Sports Doctor, brought to you by Cross Keys Physical Therapy with locations in Sicklerville, Woodbury, and Washington Township. I'm Joe Chapana. We are live for the next half hour, and tonight we're going to focus in on the back. And even though we'll be talking about back pain and back problems, if you have other orthopedic questions such as the shoulder or the knee or the hip, we'll take those questions as well. Tonight to answer your questions, we have Dr. Stephen Valentino, who is a board-certified orthopedic and reconstructive spine surgeon. His practice is located in Turnersville and also King of Prussia. And to his right is Dave Anselmo, who is a physical therapist with Cross Keys Physical Therapy. Cross Keys Physical Therapy is offering free evaluations for the next 2 weeks. To take advantage of that offer, we'll give you the number of your nearest Cross Keys Physical Therapy Sports Medicine Center near you at the end of the program. Right now, though, let's begin our conversation on the back. And Dave, if you can give us a brief anatomy of
Sure.
Some of the areas we'll be talking about tonight.
This is the spinal column here. Start at the top here. This is cervical spine. There's 7 cervical vertebrae. And we got the thoracic. There's 12 thoracic vertebrae. And here's the lumbar, which we're going to talk mostly about tonight. There's 5 lumbar. And there's the sacrum, which is the darker below.
Lumbar, of course, lower back area, and one of the more common lower back ailments, I guess you could say, would be a herniated disc. What treatments are available, Dr. Valentino, for those suffering from that?
Well, there are several different treatment options. Of all the patients who present with back pain, actually only about 2% of them will go on to require surgery. So most of the time we're getting people better without surgery. And that would be initially some rest, some medication, and a big form of therapy, or a big form of treatment is physical therapy, whether it be aquatic or land exercises. Normally, if someone doesn't get better with some therapy, it probably is time to see a specialist and consider the next phase of treatment, which might be some injections, and to consider surgery only when they've exhausted all other conservative means.
What type of symptoms or how much pain would be involved for someone to decide to seek surgery?
Well, in someone who had severe pain, not only back but normally leg pain, signs and symptoms of sciatica or an irritated pinched nerve, back pain, leg pain, numbness, weakness, these are all signs and symptoms of a nerve being pinched in the back, exiting, going into the leg. So they have to have the appropriate symptoms. They have to have not responded to conservative care. They have to have appropriate clinical exam findings consistent with a diagnostic study, such as an MRI. And it's only in this subset of patients where they might be candidates for surgery.
How would you describe the pain from a herniated disc? Is that a constant pain? Is it a throbbing? Is it a twinge?
It's usually a shooting or radiating pain. A lot of patients who suffer from disc herniations in the back may not even have much in the way of back pain. They'll have just the radicular or nerve root pain, so they'll have leg pain, some tingling, maybe a subjective sense that the leg's not as strong as the other leg that's not affected. And the symptoms can be severe, particularly if it's an acute or new disc herniation, and if it's a large disc herniation. Sometimes the only relief transiently might be just to rest, sometimes in a fetal position. Other times, when the disc herniation is not as large, they may have some more intermittent type of symptoms.
Okay, you are watching Sports Doctor, and before we go any further, I want to put up our contact numbers tonight. If you have questions about back pain or really any type of orthopedic pain you may be experiencing, our toll-free number is 1-888-634-7488. You can call that number with your question, or a local number is available too. That's 856-767-8884. If you're more comfortable on the internet and emailing your question to us, you may do that as well. Our email address is wpsjtv@aol.com. Again, Dr. Stephen Valentino with us, and also Dave Anselmo from Cross Keys Physical Therapy. And Dave, how can physical therapy help a patient who is suffering from back pain?
I think one of the real important things that a physical therapist does is really give a thorough evaluation. During the evaluation, really, with the therapist, is really trying to find out not only what their limitations are and what type of problems the patient might have as far as symptoms, but really what's caused the problem to occur. I think because there's a lot of physical therapists, we will treat these symptoms, but unless we find out what has caused the problem and address that to prevent it from coming back again. I think that's a real big factor that most physical therapists really have to attack more at.
And what are some common causes that you might see?
Well, believe it or not, one of the most common causes are really poor posture. You see a lot of patients that come in with have just poor sitting posture or poor lifting techniques that really can cause problems on the low back. And unless we change some of these things, then they lead to further problems like bulging disc or herniated discs.
Okay, we are talking about back pain tonight. It is Sports Doctor. Dr. Valentino, when we're talking about the surgery, how long is the hospitalization and the recovery time for someone who's having surgery to correct a herniated disc?
Well, the hospitalization is typically just overnight. The incision to remove that is very small, about an inch or so in length. The surgery for a single level disc herniation would probably take, from start to finish, only about an hour and 15 minutes, give or take. The patients usually go home the next day, and they have to rest and take it easy for the first 2 weeks. And then that's usually followed by a course of physical therapy, getting them back into shape, reconditioning their legs as well as the back. That course of therapy can last anywhere from 1 to 2 months, depending on what the patient's pre-injury job was. If they have a more sedentary type of job, they can probably be discharged to a home program and return to work a little sooner. We try to get them to return to normal function or as close to that as soon as possible. If they have a very laborious type of job, then might need some additional therapy and some work hardening and things of that nature prior to getting sort of back into life.
And the procedure for the herniated disc, what is actually being performed? What are you doing to the patient?
Yes, well, what I'm actually doing is removing the part of the disc which is causing nerve impingement. If you think of the disc as a shock absorber in the spine, it looks analogous to a jelly donut. The outside of the jelly donut is the annulus, the inside is the nucleus. A disc herniation is essentially when you have a tear in the annulus such that the nucleus has slipped out. That's the term where we get the term slip disc. In other words, if you go back to the jelly donut simile, you have basically as if you squeeze the jelly donut to the point where some of the jelly has popped out. The surgery eventually goes in and just removes that part of the jelly that has squirted out and is causing pressure on the nerve, relieving the sciatica or leg complaints.
Okay. How about neck surgery? Is that something you do as well?
Yes. I subspecialize in spine surgery, so I do the complete gamut of spine surgeries, neck, upper and lower back.
Okay, we're talking about back pain tonight. Actually, really any orthopedic question you may have for us tonight, which would include the neck, the shoulder, the knee, but primarily the back. If you're experiencing back pain tonight, we want to hear from you. Toll-free number is 1-888-634-7488 for your question, or our local number is 856-767-8884, and if you prefer to email us, our email address is wpsjtv@aol.com. Dr. Valentino is our guest, and also Dave Anselmo. And Dr. Valentino, I heard about a new surgery that's done to the back in which a wire is placed into the disc. What is this and how is it performed?
Well, this is a procedure that's done for annular tears. If you go back to the jelly donut scenario, it's a tear in the dough. So this is not necessarily someone who has a lot of sciatic or leg problems, but more so back pain from an annular tear. And there is a procedure, if they don't get better with conservative care, it's called an IDET, or intradiscal electrothermal therapy. And essentially what this involves is temporarily placing a wire inside the disc. The tip of the wire is then connected to a machine that basically heats up the outside, the tip of the wire, and that can seal off that tear. So patients come in, this is done under local anesthesia with some sedation. The wire is placed, the annulus is sealed off, the wire is then pulled out, and patients basically leave with a Band-Aid.
So you seal off the hole, I guess? That's
right, the tear, the annular tear, that's the goal of that surgery.
That sounds very non-invasive.
Talk
about surgery. You see this sometimes where hardware is put in someone's neck or back. Is that necessary when a fusion's done?
It's not absolutely necessary. There are certain conditions in which that would be advantageous. But fusion surgery has been around for quite some time. It actually started way back when tuberculosis was popular, and for many, many years this was done without any instrumentation. So in some conditions it is beneficial. In most, however, it's really not, particularly one-level fusions. The disadvantage of the hardware is that it increases your operative time, can increase your risk and potential complications, and can sometimes prolong your recovery because of those factors. So sometimes it's needed, but a lot of times this can be performed, fusion surgery can be performed very successfully without it.
Okay, you're watching Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, and Washington Township, offering free evaluations for the next 2 weeks. We'll give you the numbers to take advantage of that offer in just a little bit. Right now, our toll-free number with your questions about back pain, 1-888-634-7488. We're coming back, going to the phone lines right after this. Stay with us at Sports Doctor.
Doctor will be right back.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy. Sicklerville, Woodbury, and Berlin.
Imagination. It may be the most precious of natural resources. To a child, playtime is a rehearsal for the real life they will one day inherit from us. How will they handle the challenges? What choices do they make? Who do they pretend to be? Love that part of your child that longs to daydream. Don't underestimate the power of play.
You're watching Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, and Washington Township. I'm Joe Chipana. We are live. We're talking about back pain tonight. We have Dr. Stephen Valentino with us, who is a board-certified orthopedic and reconstructive spine surgeon who practices in Turnersville and also King of Prussia. And we have Dave Anselmo with us as well. He's a physical therapist with Cross Keys Physical Therapy. You want to reach us tonight with your question? Our toll-free number is 1-888-634-7488. On the line, we have Celia from Sewell. Celia, are you there?
Hello.
Hi.
Yes, hello. I wanted to know, is it possible that getting a draft on your back can cause back pain? Because it seems like every winter, if I don't wear a long undershirt or a turtleneck or something, and I get a draft, I get a chill, I hurt for days and days afterwards. What's going on with that?
A draft as a source of back pain. Does that happen?
It can, and it's just probably how your body and particularly your muscles, or what's called the paraspinal muscles, are reacting to the cold. And perhaps, in addition to trying to stay warm, maybe getting into a good exercise program. One of the advantages of exercise is that it will increase the local blood supply to the muscles, and you might not have as much problems with that in the future.
And we're getting to that time of year again. Cold outside, and in fact, it won't be long before we'll be shoveling snow, unfortunately, which is always bad for the back. 1-888-634-7488, our toll-free number. Also, 856-767-8884. We'll check our email in just a bit. The address is wpsjtv@aol.com. Dave Anselmo, I've read a lot of people miss work because of low back pain. Why do you think this is, and what can someone do to minimize that?
Well, actually, statistics show us that basically about 85% of all low back problems is really a result from poor posture. And so those people that are out there may have low back pain right now and not quite sure why they have it. You might want to take advantage of the free evaluations that we're offering. Maybe it might be something basic as coming in and us showing you how to sit properly or teach you different techniques of what you could do differently at the job. So that's something that we see a lot of.
Okay, and I've just been informed that our internet, our webs, I guess our email address is down, unfortunately. AOL is down, so if you have a question tonight, you're going to have to call us It's toll-free, 1-888-634-7488, locally 856-767-8884. Let's go to the phone lines and talk to Doris from Browns Mills. Doris, are you there?
Yes.
Doris, thank you for watching. Your question tonight.
Yes, I was told that I have 2 bulging discs and 1 out of alignment.
Mm-hmm.
And I've been to physical therapy. I've had steroid injections. And I'd like to know what else could be done.
Bulging disc and 1 out of alignment.
Well, I guess the first thing I probably would want to know is what kind of therapy you've actually been through. A lot of times when individuals have problems with the disc, they're starting to wear out and bulge, kind of like squeezing a balloon between your hand. It bulges at the side. And getting into a program such as a spine stabilization program, trying to strengthen your abdominal muscles, your stomach, your flank or outside, and your low back muscles will kind of almost serve as an internal brace and take some of that pressure and load off the discs that are bothering you. Other things to consider would be your posture, your body habitats. Sometimes if you do heavy work and you have this type of problem, even just wearing an external support or brace to get you by without any type of aggravations can be beneficial as well.
How is a bulging disc different from a herniated disc?
Well, a bulging disc typically is a consequence of the normal age-related process. The disc, as I said, is a shock absorber, and when we're young, it is very hydrophilic. That means that it has a lot of water in it. Once we start to turn about the age of 20 or so, that water content begins to diminish. The disc can begin to dry out, and we call that desiccation or degeneration. And because of that, just like squeezing a balloon, it begins to bulge at its sides. A disc herniation, on the other hand, means that there's a significant tear in the outside of the disc, that annulus, such that the interior has essentially herniated out through the confines of the disc and is now outside the disc.
Does a bulging disc eventually herniate, or
no?
No.
There's nothing to say that if you have bulging discs, you're destined to have herniations.
And what are the treatment options for bulging discs?
Bulging discs largely are non-surgical options. Rest, medication, if you're heavy, trying to lose some weight, basically getting in a lot better shape. Therapy, perhaps some injections, a brace once in a while if you do some heavy work. Beyond that, there are some surgical options, but they're really reserved for people who haven't responded at all to conservative care, such as if you have a tear in the outside of the disc that's bulging but it's not yet herniated, going in and doing that IDEP procedure with the wire sometimes may be beneficial.
Now, you mentioned overweight, and I've also read where strengthening the abs is actually something that is good for the back. Is that true, Dave?
Very true, yeah. As the doctor nicely explained, really strengthening the abdominals and the back extensors and the flanker muscles are very important to give you real good support around the spinal area. You want to do that because if you don't, that's where you start to have the give and the flexibility of instability in the spinal canal, and that's not what you don't want.
Okay, you're watching Sports Doctor. Again, we're talking back pain tonight. Just to remind you that Cross Keys Physical Therapy is offering free evaluations for the next 2 weeks. And at the end of the program, we're going to give you numbers to reach the Sicklerville Center, the Woodbury Center, and the new Washington Township Center to schedule your appointment for that. Right now, though, if you have questions about your back, 1-888-634-7488 is our toll-free number. And locally, it's 856-767-8884. We have Dave Anselmo with us from Cross Keys, and also Dr. Steve Valentino, who is a board-certified orthopedic and reconstructive spine surgeon. 1-888-634-7488. How about the internet as a source for information? Is that a good place to find out about back pain?
Well, actually, most of the times, no, it's not. There is a study done on back pain information on the internet, and they found that through the course of time, this was not reproducible. A lot of the things on the internet were an attempt to prophesy something or sell something. So while there may be some good sites, largely the information was not dependable. So I guess the answer is listen to your doctor.
Too much information can be a bad thing. What about, what if I see you for back pain and I decide that I don't want surgery or it just doesn't fit for me?
Right.
Will you can still see me as a patient?
Sure, that's what I do most of the time is attempt to get people better without resorting to surgery. So if you see me and you have a back problem after a thorough evaluation, perhaps some testing, we'll set a treatment plan, whether it be some medication, some posture and activity-related modification, course of therapy, perhaps some injections. There's a lot of things that we can do to get you better short of surgery.
Okay, we're going to take another short break. Again, you're watching Sports Doctor, brought to you by Cross Keys Physical Therapy. We're talking about back pain tonight. We'll go back to the phone lines in just a bit. Again, the toll-free number is 1-888-634-7488. Stay with us, more of Sports Doctor right after this.
Sports Doctor will be right back.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy. Sicklerville, Woodbury, and Berlin.
Plastic ones last longer.
Pork bellies close steady due to speculation that demand for bacon-related products.
Read me this one, Daddy.
Okay, honey. The less art kids get, the more it shows. Are yours getting enough? Art. Ask for more. AmericansForTheArts.org.
It is Sports Doctor. We're here every other Thursday night. We're brought to you by Cross Keys Physical Therapy. They're offering free evaluations for the next 2 weeks. If you would like to see someone, we'll give you the numbers for their centers in Sicklerville, Woodbury, and Washington Township in just a little bit. Right now, our toll-free number is 1-888-634-7488. If you have questions about your back pain, you can call us up now. Also, a local number is available too. It's 856-767-8884. We have Dr. Stephen Valentino with us, who is a board-certified orthopedic and reconstructive spine surgeon, I should say. His practice is located in Turnersville and also King of Prussia. And Dave Anselmo is with us as well. He is a physical therapist from Cross Keys Physical Therapy. To the phone lines we go, toll-free, 1-888-634-7488. Let's say hello to Jennifer in Vineland. Hello, Jennifer. How are you?
Hello. I'm calling about my husband. He has an L5 disc protrusion. It was really, really bad. Now it's just an ache. And the physical therapist said to wait 8 months till it heals and then see if he needs surgery. But the doctor said he should have surgery sooner. And my question is, if he does wait the 8 months, will the surgery still be successful, or does it have less of a chance of working if he waits longer?
Okay, tough question there. I guess, and again, you haven't seen the patient, so it's difficult to answer, but some thoughts?
Well, he just has kind of a ache in the low back, which is only occasional and mild. Is that correct?
It was acute, but now it's kind of getting into an ache.
Okay. And does this interfere with his lifestyle, what he has to do, work, getting around?
Yes.
Does he have much in the way of leg pain, or is it mainly back?
It does go down into his leg, yes.
Yeah. Well, it would depend on a few things. His neurologic status, if he was actually having neurologic problems such as weakness or numbness, and if these were progressive, that's not something that you would want to wait. That might be something that might help you decide to have the surgery because you want to preserve neurologic function and have as much recovery as possible. If his neurologic exam is normal, he can certainly continue the conservative care, perhaps try some different types of medication, some injections, which will hopefully get him by. But I think I would approach it in that fashion. A lot of times he can continue to improve and avoid surgery. That's not possible, however, in every patient. And if he's having significant problems and nothing else is working, and he does have significant nerve damage, then it might be a good idea to consider having the surgery.
Thank you for the call. Thank you for your question. And again, they're offering free evaluations for the next 2 weeks at Cross Keys Physical Therapy. We'll give you the number for that at the end of the program. Toll free right now, 1-888-634-7488. The decision to postpone surgery, doctor, is that, I mean, you've said yourself it's surgery is a last resort. Does it make the surgery less likely to be successful if it's postponed too long, or does that bear in it at all?
There is a certain time period where if you're going to do surgery, you're going to get the best neurologic recovery. But that's really within the first year, year and a half or so. So you do have much time to wait and see if we can get you better without the surgery. You probably wouldn't want to wait too much beyond that time period, because the longer a nerve is pinched, the less of a chance it has to recover and come back. And that's what you're doing with at that point.
Okay. Should we go? Okay, we'll take the call. Nancy from Riverside, thank you for watching. Your question tonight? Hi. Hello, Nancy.
Yes, I have pain in my back, and it goes down to my leg. And I've had physical therapy. I've had injections. And my doctor said that I might need surgery. And I'd like to know if this should be an option.
Sounds a whole like Lou Gehrig there, doesn't it?
Well, it may be. I mean, it depends on a whole host of things. Not only your symptoms, which you told us about, but what your physical exam shows, to review your records and what kind of therapy you've actually had, what kind of injections you had. Perhaps there's different types of injections which could still be available to help you. And of course, it also depends on what your tests show, your MRI, and one would need to put all these things together to determine whether you were a good surgical candidate or not.
Okay, about a minute left, maybe 30 seconds. Real quick, Dave, aquatic therapy for back pain?
Yeah, I think like the doctor mentioned, there's a lot of different options with not only medications, but different options with physical therapy. Well, land, but we love to use aquatic, especially for the spine, because we like to take advantage of the buoyancy of the water. We know that decompresses the spinal canal and allows us to be a lot more aggressive in strengthening the back and abdominals early on, and allows us to progress them onto land a lot faster. And contrarily, they get back to work faster.
And of course, aquatic therapy is offered at your new location in Washington Township. Have the numbers up on the screen if you'd like to take advantage of the free evaluation offer. The number to reach the Sicklerville office is 856-728-1900. In Woodbury, where they also have aquatic therapy, it's 856-853-0988. And in Washington Township, 856-374-3707. I want to thank Dr. Valentino for joining us tonight. Again, he's a board-certified orthopedic and reconstructive spine surgeon. His practice is in Turnersville and King of Prussia. And also Dave Anselmo, thank you as well. Thank you for joining us. We're back 2 weeks from tonight with another edition of Sports Doctor. Until then, for Cross Keys Physical Therapy, I'm Joe Trapano. Stay well.
WPSJ-TV has been producing television shows in the Delaware Valley for over 10 years. Call us to produce your program.